Welcome to the Vitreous Podcast, where we help women and families achieve their best health, body, and soul. Here are your hosts, Lisa Marino and Aaron Hazelbaker.
Hello and welcome back. My name is Lisa Marino, and I'm excited to have back as our guest Dr. Kathleen Berchelmann from My Catholic Doctor as we discuss telehealth. Telehealth or telemedicine is a very important topic as there are so many unknowns and uncertainties about the future of traditional healthcare right now. There is no time to waste to get healthy and stay healthy. And the good news is that telehealth in general has an 85 to 90% patient satisfaction rate. That is really good when you consider how new and very different it is to traditional medicine. So we're going to get into what is telehealth or telemedicine. Is it really that effective? Is it appropriate for women's health, pediatrics, or chronic disease? And I'm really excited to announce that mycatholicdoctor.com providers are able to order COVID-19 antibody testing. Dr. Kathleen has told me that most insurance plans are providing coverage for the antibody testing, so this is really helpful. You can learn more about the testing at mycatholicdoctor.com/coronavirus. Additionally, you can check out our Victress virtual physical therapy site at victresshealth.com/Anna/virtual. Most insurances are also offering telehealth coverages, even for physical therapy at this time. We are seeing an obvious spike in the need for anxiety, chronic pain, obesity, and headache treatment, just to name a few. So don't waste another moment in pain. And again, that's victresshealth.com/Anna/virtual. Before we begin in prayer, I just want to mention that I'll be your solo host today. My co-host and sister, Erin Hazelbaker, is flooded with treating patients herself right now as a home health physical therapist in the midst of the coronavirus right now. So we thank her for her dedication and sacrifice and pray for her as well as all of our healthcare providers and family members serving the sick right now. Let's begin in the name of the Father, and the Son, and the Holy Spirit. Amen. Heavenly Father, we thank you for your goodness and all the blessings you constantly bestow upon us. Grant us faith and trust that we may better depend completely upon you and your divine will. Protect our families and communities as we pray for the conversion of our nation and world and an end to the coronavirus. We ask this in Jesus' name. Amen. Mother thrice admirable Queen and Victress of Schoenstatt, pray for us. Immaculate Heart of Mary, pray for us. Sacred Heart of Jesus, have mercy on us. In the name of the Father, and the Son, and the Holy Spirit. Amen. So Dr. Kathleen Berchelmann is our guest today to explain telehealth. Clearly a pioneer ahead of our times, 2 years ago, Dr. Kathleen founded My Catholic Doctor, which is an online network of Catholic telehealth providers for the full spectrum of family needs with a dedication to Catholic teaching. Dr. Kathleen is a pediatric hospitalist in Connecticut, just an hour outside of New York City, where the coronavirus has hit the worst. As a mom of 7, Dr. Kathleen has completed a fellowship in medical ethics from the Weston Jesuit School of Theology. Her work has been featured in Time Magazine, NPR, Fox News, Parents Magazine, and the Sunrise Morning Show. Dr. Kathleen, thanks so much for joining us.
It's my pleasure. Thank you for your good work.
Okay, so let's just dive right in. What is telehealth?
Well, telehealth is also called virtual medicine, and really it means practicing healthcare from a distance. So whether that's over a telephone or more commonly now through video communication, or even texting pictures to a doctor to evaluate and then getting an answer, a text answer back, whether that's by email or text messaging.
Well, that's something I do with my sister already. So I have 2 older sisters that are physicians. So I'm like, hey, that is telemedicine. That's great. So that's something that your providers, your physicians do on your website?
We do. And it's meant to be super easy. And we do it in a HIPAA compliant manner. So it's consistent with all privacy laws and regulations. And I would add that our platform was consistent with all privacy laws and regulations before the coronavirus pandemic. And many of those rules have been loosened over the past several weeks, but we expect that they will really, the regulations will come back into effect eventually, but we always have been and always will be compliant with the law and with the telehealth privacy regulations. So your information is really very secure. And we take that very seriously because we know that patients talk to us about very, private, personal things.
Yeah, absolutely. So how does it work? What does that relationship look like as far as, becoming, having a relationship with a provider on your website?
All you do is go to mycatholicdoctor.com and you pick your provider and you click to make an appointment. There will be it's super easy. We went through, as our organization grew, we had to change our technology. Our original technology was not very user friendly, but we're really delighted and thankful to the Lord for our new technology, which we feel is super user friendly. And all you do is it's click to make an appointment, click to pick your time. You type in a few pieces of information, very few pieces of information like your name and contact information, and then you're going to get a link when it's time for your appointment. You get one link at the time you make an appointment, and then you get a reminder a few minutes before your appointment, and you get that reminder by text message or email, or both, depending on what information you provide to us. And you just click the link. That's it. And then you're chatting with your doctor in a video chat, and then that's how we move forward. That's how we get started. Once you're established in our system and in our patient portal, then it's real easy to send email type messages that are HIPAA compliant and pictures, and you don't even have to video chat with us if you have a question.
Oh, that makes sense. Yeah, that's great. So is it something you can do from your phone or computer or a tablet?
Any device of your choice.
Okay, great. Because I know certainly there's a certain element of like people being, feeling like they have to be tech savvy, but I think I would say all of us are pretty familiar with things like FaceTime at this point, and certainly
You don't, 2 days ago we treated a 94-year-old. Our platform is designed to be super user friendly, especially for people that are not tech savvy.
Awesome. And how important that is right now. I mean, just thinking of parents and grandparents at this point, because they're not getting out to those regular, physician visits right now. So needing to stay in contact or to make keep those, that communication going, at least at this point. I know one of my biggest concerns is things like deconditioning, as we're staying in the home more. So it's being able to stay up and check on, family members and stay in contact with, new symptoms and complaints, right?
For sure. And keep people moving. That's part of what we tell people.
Yeah, absolutely. That's where we come in, right? Well, that's great. So, what are some of the typical, I don't want to say diagnoses, but patients that you're seeing, populations that you're seeing? Is there a certain, patient population that you tend to prefer, or, what are we looking at here as far as patient population?
So my Catholic doctor sees patients of all ages and at every stage in life, from conception until death and until natural death. And we are very delighted to offer a full range of services, and we are active in 50 states. So we offer probably our most commonly requested services are our specifically Catholic services, including our infertility care, mental health, natural family planning services, adolescent medicine, caring for teens that are having, menstrual issues and acne issues, and often the only solution offered to them is oral contraceptives or even IUD or Implanon. And we're here to work with them from a truly Catholic perspective, and give them all of their options. So we also offer end-of-life care, and incredible hospice nurses available for consultation. We offer a second opinion and consultation service. So if you find yourself, you or your loved one is suddenly critically ill in some hospital and you're assigned a ICU doctor or a hospitalist, and you don't know this person and they're making recommendations about end-of-life care, and you're nervous about them and you want a second opinion, we're here for you. You can pull us up right on your cell phone. We'll chat. You ask the doctor for a second opinion consultation through us, and we talk to you and your doctor and talk through the whole situation. And those are just a few of our services. We also offer the full range of virtual primary care and urgent care services, functional medicine, weight management, and also wellness programs. We're delighted to partner with 2 90-day wellness programs. One's called Stronger Catholic, and the other is called Catholic Well. They're 90 days to a healthier you.
That's awesome to have like the full gamut, you know what I mean? Whether, pregnancy or like you said, parents. I mean, how important is that, especially right now when you're like, just confused, a lot of decisions are being made, especially right now when we're, separated from loved ones and family members that, potentially are being sick or, getting sick, contracting coronavirus. So, that is awesome. What would you say, I guess let's speak to, kind of the Catholic piece to it, because, this is a largely, Catholic Christian audience, and, the importance of that, because I'd say, many of the instances that you just brought up can be very challenging conversations, on one hand, but then let alone, bring in the medical side of things. So, just speak to the Catholic piece of your work into the providers, as you choose them too.
Well, all of our providers agree to answer the call of Jesus Christ to heal the sick and proclaim the kingdom. And we integrate Catholic teaching and spirituality into our care as appropriate to the situation. So, I'm not praying with every child that has pink eye, but there certainly are situations where integrating spirituality are more appropriate. And then there's the whole piece of the specific Catholic healthcare that we really, Catholic healthcare for 2,000 years has really focused on the comprehensive care of the person, mind, body, and spirit. And and also really clearly identifying a diagnosis before initiating treatment. Now, nowadays, we have a whole bunch of new secular terms for the same thing. Like one of them is functional medicine. What is functional medicine? Well, at its core, it's recognizing how medical needs integrate into a person's life and lifestyle, but and also diving deep into the diagnostics and understanding why a person is having the symptoms they are, rather than just treating the symptoms. But this is nothing new to Catholic healthcare. We've done it for 2,000 years. And in terms of women's health and fertility, there are fancy names for this, like restorative reproductive technology and NAPR technology. But really, it's all the same thing, which is treating the mind, body, and soul, and really strong diagnostics before initiating treatment.
Wow, I mean, I think it just, speaks volumes to the value of care and, just for yourself, and then, just really forging the path of saying like, hey, we can do this better. Like there is, and really it's, it seems like reinventing the wheel, but like you said, this is exactly, the model that we have been, trying to follow by example, of, like you said, treating the whole person, and like, let's get down to really getting down to the bottom of it. And I would say, for myself, that's probably the most rewarding part of it, is like, let's get down to the cause, like what's really going on here.
That's right. Yeah.
So, I just have to say that would resonate a lot, with my patients, and especially, just in this area of like, Northwestern Ohio too, where we are at, really wanting to treat the cause and absolutely bringing it from a Catholic perspective. What would you say are, some of the biggest barriers if somebody, is apprehensive to do telemedicine?
I think that I think that people are a little nervous that they're not going to be well cared for. The first is there's a sense that the doctor can't really get a good exam, and I'd like to talk about that. And the second is the sense that this person kind of distanced from may not really care about them, or just, real quick and easy, examine, push a medication or a prescription. Let's start with the second. So, traditionally, telehealth in the United States over the past decade or so has been offered by these major large organizations. And it's sort of been considered an option for minor illness when in, odd hours on nights and weekends when your primary care doctor may not be available. You can call one of these services and you talk to somebody for just a very short amount of time, and they hopefully take care of what you need. but we're a different organization where we really are here to get to know people. We see ourselves as providing a deep doctor-patient relationship and strong diagnostics and strong medical care. And we hope to have ongoing relationships with patients and families, not one-time visits. And at My Catholic Doctor, you're going to pick your provider. Unlike these major organizations where you just get like the next person in line, and My Catholic Doctor, you pick who you're going to see and you make your appointment. Now, as for whether or not it's a complete exam, does the doctor really understand what's going on with you? Can your doctor really take good care of you if they're not examining you in person? And it's amazing. That's the primary thing I hear from patients, and it's like not the concern of doctors. And I think it's because doctors know that old-fashioned medicine, the way we're trained, that most of your data actually comes from a very good history from talking to the patient carefully and closely. And then the subset of your data is going to come from physical exam, and then you get more data from testing like labs and x-rays, right? And the physical exam can be done via telehealth quite well with a few key limitations. Now, we use various instruments, and most of them, many people already own, like a bathroom scale, a fingertip pulse oximeter, which you can buy for about $20 at any major retailer. That tells you how much oxygen is in your blood and also gives you a heart rate or a pulse. And then we also use a video otoscope that you can buy on Amazon or any major retailer for about $25. And it just plugs into your computer or your smartphone, and you can get a very good view of the eardrum. That's especially important in pediatrics. You can get a very good view of the throat or the pharynx using the bright light of a smartphone and a smartphone camera. And then the hardest piece of equipment to purchase is the stethoscope. They're still very expensive. They cost about $500, which is not reasonable for most families. And so I'm usually doing these exams without a stethoscope. And so, I'm doing my lung exam by looking at the chest to see if the patient is retracting, by listening for coughing, by asking the patient to take deep breaths, by the pulse oximeter reading. And I would admit that that's the primary limitation is the lung exam. But we are using other evidence-based remote patient monitoring devices and questionnaires for management of asthma. And finally, there's the abdominal exam. People worry about, what about that abdominal exam? Well, I'm a pediatrician, so I'm usually asking the mom to do it. And I find that I can get a pretty darn good exam just by carefully asking the mom to do it. And I would add that there's some benefits, that the child is less scared to have mom touching them than an adult, and there's less hesitation on the child's part.
The same piece I might cut in is that then they're learning, and that they're, it's a value to the family to know what to look for, to know, how to, educating them as well,
We do, and it's very empowering for the families, and that's our goal, really, to empower parents, patients, and parents, right, and caregivers. And that's exactly what happens. The first time people use one of these video otoscopes, and they buy them from Amazon for $25, and they see their eardrum, like they look at everyone's eardrum and the whole family, right? and then I get a call that says, "Hey, here's the pictures I already took of the eardrum. Is this infected? I want to know what's infected. When do I need to call you?" So what are we doing? We're empowering these families.
Amen. That's one of the best things I love about, stepping back, in healthcare, to be able to, like you said, empower and to educate and to, really give them the tools and the knowledge that they need to know to make, great decisions for their health.
That's right.
That's awesome. Good. Anything that go ahead. Sorry, I did cut you off. Yeah.
Yeah, no, I just want to add, though, that we, especially at My Catholic Doctor, we recognize the limits of telehealth, and there's state laws about this, but beyond laws, it's just ethical. But there are plenty of things we can't do by telehealth, right? We can't deliver a baby. I can't, do surgeries. One of the limitations is lung exam, especially asthmatics. Those, whenever we recognize that a patient that's not appropriate for telehealth, we do make a referral for in-person care. But we find that we can take care of about 92% of issues by telehealth alone, especially if we're including second opinions in that. So I can, for example, if I'm seeing a patient for a minor mental health issue such as depression or anxiety, and I'm prescribing a common medication for that, but then something happens and I think, oh, I really need a psychiatrist opinion, I can pull a psychiatrist into a third window. We schedule it and have a psychiatry consultation together with the patient or parent, and and you know, and get the care that child needs or that patient needs without referring them to an in-person visit.
And how, invaluable that is as well, to have that direct communication, right away with a provider. I mean, sometimes that's just a barrier. You make this referral and it's like, oh, did you follow up with Emma? No, but it's, what I mean? Like, it's going to happen, if you do it through telemedicine, it will happen. What I've found, just looking at the research in telemedicine, is that largely people are satisfied with it. They like it. Is that the same thing that you're seeing in the research?
I think you have to try it once and you're pretty much sold. And my prayer is that when people try it once, they don't, they get a really great doctor, that it's not somebody that blows them off and, doesn't even listen to their symptoms and writes them a prescription without really understanding the problem, right? My prayer is that when people try telehealth the first time, they get someone that really takes good care of them. And I think if that happens, especially if people have access to these really cool devices, they're really empowered to see their eardrum, to hear their heart and lung sounds, to see their blood pressure on the machine, to see their oxygen saturation, and they're doing it themselves. They love it. It's so different than having this medical assistant come in and put a bunch of devices on you and write down a bunch of numbers, and you don't even understand what that means.
Absolutely. Well, speaking of to that, what do you see going forward being some of the benefits and advantages to telehealth and the importance of it as we go forward with the coronavirus?
Well, certainly in times of pandemic, it allows healthcare to continue. But outside of a pandemic, telehealth allows people to have one doctor and a medical home. Because let's face it, people don't stay put, especially nowadays. People travel for business, families move, adolescents go to college, and telehealth allows you to stay in touch with the same doctor no matter where you are.
Wow, that's great. Anything else that you'd like to add or share or let our listeners know?
Catholic healthcare has for 2,000 years been the answer. We've been the leader in healthcare worldwide for 2,000 years. In fact, the hospital system grew out of our monastic system. And it's long been our tradition to provide incredible healthcare with incredible ethics. And good ethics is good medicine, and good medicine is good ethics. And today, it's no different. We continue to offer cutting-edge technology and advanced diagnostics from a Catholic perspective. And we continue to do it, treating the whole person, mind, body, and spirit. And we're here for all of you, regardless of faith or creed.
Wow, that's great. So let's just end. I'm going to share, you can find Kathleen on mycatholicdoctor.com. Please go check out their website. It is super easy to use, and you can find a whole host of providers just in your state alone, and obviously across the country that are able to serve you. And if you are struggling with pain or you are ready to tackle those health goals, don't forget to check out our virtual physical therapy site. That's victorishealth.com/Anna/virtual. Thanks so much, and we'll see you next time.